Good afternoon, everyone. We'll get started with our afternoon session of our Quality Symposium. I hope you all enjoyed your lunch, and I'm looking for some positive feedback on the evaluation forms about our lunch this year. Hopefully we made improvements from where we were last year. So our next speakers, I'm proud to introduce Gord Milak and Gillis. They're going to be presenting our Southwest Quality Improvement Enabling Framework. Now, Gord Milak is the Senior Director of Performance Management and Accountability with the Southwest Community Care Access Centre. And our own Gillis is our Senior Director of Planning, Integration, and Community Engagement with the Southwest LHIN. The quality framework that you're about to see was developed by the Southwest LHIN Quality Advisory Group to inform their activities and to guide the Southwest LHIN's efforts to advance quality improvement as a system change strategy. You will also hear examples of how the framework is being realized across the Southwest LHIN. The framework was initially created to be used at the LHIN level, but it is also relevant at the initiative and organizational level. That is why we've decided to share it with you today and hope that you will see its relevance in your care setting. Kelly and Gord will each present, and then they'll open it up to questions, and then they'll also guide you through the table discussions that will take place for this afternoon. So with that, I will pass it over to Gord and Kelly.
Well, good afternoon. We're very pleased to be here this afternoon, and Gord and I are happy that we're able to present this framework this afternoon. Of course, we did get the dreaded after lunch spot, so hopefully we'll be able to keep you all awake. Just before we get started, I'd like to see a show of hands. How many of you were actually at our first annual Quality Symposium last year? Wow, tremendous. So some of our efforts were to create some alignment back to what you heard at the session last year. So I'm sure all of you that were here will remember Jim Easton, and not that we're here to say we can take Jim's place because he did a fabulous job last year. We have tried to emulate a little bit of what Jim Easton brought to our session last year. So for one, the framework that we're presenting to you today draws on what you learned about last year as the massive improvement machine that the UK is trying to implement to advance their quality agenda. And the second thing that we've done is we're attempting to use the Prezi presentation format that you saw last year. So a huge acknowledgement to Nicole Robinson from our office who put this together for us so that we could attempt again to emulate Jim's presentation and do this in the format of a Prezi presentation. And hopefully that all works. So when we started to think about how can we really enable quality improvement within the Southwest LHIN at a system level, we went to that place that we like to go around. What are the tools that can help us to do that? And so we really became focused at our quality advisory group on the creation of a quality enabling framework or a quality improvement enabling framework. And one of the things we're speculating is that probably a lot of the organizations in our LHIN don't yet have a framework. So I'm just wondering if people can raise their hand if you feel you are following a framework for quality improvement right now in your organization. That's great. So some of you are, and some of you probably have more work to do on that. So we decided that it might make sense for us to take a stab at a framework that we could use in the LHIN at a system level, but could also be used at an organizational level within the Southwest. And so we looked to our quality advisory group. And our quality advisory group, you probably heard about last year, has really been with us now for just over a year. And they bring great expertise to the work we're doing around quality improvement. We've looked to that group to help us guide some of our initiatives in a number of areas. So we've looked at strategic alignment and fit, overall system performance and impact, what tools and methodologies are being used by initiatives, the extent of the partnerships, integration, engagement that's happening, how we can importantly support sustainability and spread, and again, harvesting lessons learned and best practices that can be shared across initiatives. So we see this group as a real go-to group within our LHIN that can help continue to guide our quality improvement efforts as we move forward. We have a diverse group of quality experts from across the Southwest LHIN, and we've been lucky in our first year with the group in place to have representation from individuals off both provincial and national organizations representing quality. And they've really helped us to shape our thinking around our quality improvement agenda. In terms of the various sectors that sit at that table, we have folks from manufacturing, primary care, community care and support services, hospitals, long-term care, mental health and addictions, primary care. And we've done a great job as well as bringing people together from across the geography in the Southwest LHIN. And again, they really are becoming, I think, champions for our efforts around quality improvement and helping to guide our work as we move forward. And so why are we so focused in the Southwest LHIN on quality improvement? We see it as our LHIN role to help support and enable quality improvement at a system level. So you'll see by the initiatives that we're working on, we're very much focused on that system level. BSO is a great example of that, looking at a system design across the geography like a LHIN, across the province, to improve care for that benefits our residents, patients, and clients. But we also recognize that health service providers have an individual accountability within your organizations to drive quality improvement. And so it happens at all levels across the healthcare system. And it's a journey. So we know that we're all at different stages. Each organization in this room will be at a different stage in your quality improvement journey. And we know that different sectors and different organizations are at different places. And so we have to have strategies that support and enable everybody to advance forward in this journey. At the end of the day, it's about creating that shared accountability for improving quality, because we're all here and committed to do the best that we can for the patients, residents, and clients that we serve. So I'm going to turn it over to Gord now, and he as my co-chair on the Quality Advisory Group. It's a great pleasure to work with Gord, and he's going to talk to you a little bit more about the framework that we've created.
Thank you, Kelly. So, pretty fundamental question, why a framework? Well, we've seen examples today where quality improvement either has or needs to happen to really affect the lives of the people that we care for across our system. And I'm sure that there are folks in this room that every one of you would have at least one story that would create a burning platform for change, for more quality improvement across our system. Great. So the framework is an enabler. If we look at the blueprint and we look at the IHSP, we are as a system being knitted together for the benefit of the client journey across care settings. And so a quality enabling framework helps us do that in a way that provides the level of quality and care that we need. There's also been some recent provincial legislation that's changed. And the Excellent Care for All Act may not apply yet to everybody in this room, but as a resident of Ontario, I am very pleased that that legislation exists. It was described to me in a way that is really, really stuck, in that the Excellent Care for All Act really is about delivering best or leading practice in combination with that premium, that really high quality client experience. And it's the combination of both that really is our ultimate goal. Secondly, of course, the increasingly important role of Health Quality Ontario really is going to be that enabler to support us through this as we do this as a broader health system. In Bernie's presentation earlier, he talked about the 9 dimensions, the attributes of a high-performing health system. Those, again, are that linking agent. You can see the integration that's in place here, and that's been taken into consideration in this work as well. We know what needs to change. The question is how. How do we do it in a time and a pace and at a level of quality that is really sustainable and can happen? And the enabling framework is one of the ways that we believe can assist in that process. As Kelly has said, this has been put together by the Quality Advisory Group, and it has been, there's been lots of literature searches done internationally, nationally, locally, and certainly there's been lots of engagement with the folks that are in this room on this as well. And it really starts at the heart with a triple aim. I want to ask a question. How many of you in the room are familiar with the triple aim? Great. For those of you that aren't, it's about taking a look at a process and dealing with with 3 things simultaneously. So how do we improve that person experience? How do we have the cost that's sustainable and really affect the population health statistics? So it really is that person-centered, right activity, right action, and the right intervention. At the top of the framework, it starts with leadership. And certainly that is board governance as well as executive. It's the strategic priorities, ensuring that our activities and our actions and our energies and all of our resources are really pointed toward the things that are really necessary. It also means, particularly as we go toward a more integrated system, it's that level of partnering and the quality of partnering so that we're really advancing that integration at the best way possible. It is about accountabilities and developing policy, but it's also about leadership at more than just the executive and the board level. It's about champions and leaders that happen sometimes organically or sometimes they're mentored right throughout all of our organizations. It's that frontline champion that we really need most. There is no question, I'd be surprised if there's anybody in the room that hasn't had a conversation in the last week about maybe the volume of change and the pace of change. But the reality is, quality improvement means that we have to continue to change. So how do we do that in the best possible way? Well, that's building some capacity. Certainly knowledge transfer is a critical part in helping all of us as stakeholders and providers and consumers understand where we're going. Education and training, and of course the change management component cannot be underestimated. Applying evidence in decision-making, what's important here is that it's not just about clinical best or leading practice, it's also about what are the operational supports, the non-clinical areas where we can really leverage best practices that are out there in the broader community and use those to advance our goals. We also need performance measurement, and we need a continuous process to ensure that research is being brought in. It's finding that delicate balance between innovation and achieving standardization once best or leading practice is in place. Next, it's enhancing the health information systems. There's no question that eHealth is one of the key enablers that we need to go forward. So the ability to share patient information, accurate, timely, is a critical success factor for providers at the front line, regardless of the health system or the health sector setting that client is in at that time. But it's also about helping provide decision support. And it's decision support perhaps right at the bedside, it's at the organizational level, it's at the system level, and that needs to be real-time and accurate to help us make good decisions. Next is engaging. You may remember, for those of you that were here last year, Jim Easton relentlessly telling the story. And I think today we've seen a couple of good examples. Personally, I found both of those, all of the videos, very compelling. It's hard not to hear the message when you have somebody talking. And so there are different ways that we can do that, but we have to continue to explain what and why and how we're going to get there. Lastly, it's about motivating. So we do need to make sure that we're incenting the right behaviors, but it's also about celebrating, which is partly why we're here today. We've seen those things. We had the opportunity to see those first quality awards put out today. We do need to celebrate. The road ahead is still pretty steep, there's no question, but we are making progress. And if we don't take the time to recognize that and celebrate, and we need to drive that encouragement as we move forward with our organizations. And at that, I'll turn it back to Kelly.
Thanks, Gord. So I'm going to talk a little bit more about how we think we're starting to bring this framework to life in the Southwest LHIN. And I think one of the pleasures that we had when the Quality Advisory Group did this work and created the framework was, again, recognizing that it does have applicability at multiple levels. So we're really keen on using it within the Southwest LHIN to look at how we're doing this at a systems level. We're keen on promoting the framework to health service providers so that you can use it in your own organizations. And we've also started using it a little bit to look at it at LHIN-wide initiatives or at a project level. So again, we think about this at multiple levels and think that it's quite an applicable framework and relatively simple to think about as well. So I'm just going to go back around this circle again and talk a little bit about some of the things we feel we've been able to put in place. And I was reflecting this morning at some of Mike's opening comments, and he mentioned that the table's been set. And certainly at a provincial level, the Minister's Action Plan, the Drummond Report, all of those things are showing us the direction that we need to move forward with as a system. And here in our LHIN, I think we've made tremendous progress, and I might be a bit biased, but I think we've made tremendous progress over the last 6 years. But actually in the last year, the kind of shifts that I see us making are pretty phenomenal in terms of how we're doing our work. And one of the things that really resonates most with me from last year's session and Jim Easton's messages was change at scale. And really moving away from those pilot initiatives that we can't sustain or that they do something great in their own right, but they're hard to keep in place or to spread more broadly. And really thinking about those strategic level initiatives that have the ability to impact the system across the LHIN. And through our Health System Leadership Council, our Quality Advisory Group, the directions that we set in our blueprint and our Integrated Health Service Plan, and then how we align that through the service accountability agreements, we are putting those leadership elements in place to set that direction here in the Southwest LHIN. Some of you may not be aware that this is that year in which the next Integrated Health Service Plan gets created for our LHIN, and so we're already busily working away on what our third Integrated Health Service Plan will look like for the Southwest LHIN, and we'll be engaging broadly in that process. But the kinds of things that we're talking about and the way we're framing our IHSP, to me, shows the kind of growth that's happened over the course of the LHIN's lifespan. And then in terms of building system capacity, the BSO initiative is a great example of that. And Bernie talked about the different strategies that are being used to engage and to use the learnings that come through that engagement process to create action. And the processes, the methodologies, and tools in which that's happening through BSO have really been informed and supported by the great partnership that exists with Health Quality Ontario. So through that initiative, we are building capacity in our LHIN to utilize quality improvement methodologies that make a huge impact. And that's not the only initiative where we see that capacity building strategy being put out there. Mike mentioned Residents First this morning as well. I had the pleasure yesterday to be in Chatham with 29 of the long-term care homes across the Erie, St. Clair, and Southwest LHIN. And there were close to 150 people in that room, and they were there to celebrate the success that they'd have over the last 6 months. So 6 months ago, many of them sat in a room and were receiving improvement facilitator training from Health Quality Ontario. And they brought teams together in their long-term care homes, and they're tracking data. And yesterday, there were storyboards up across the room that showed the progress that they're making, whether it was with respect to falls prevention, individuals with responsive behaviors, continuity of care. So there's a number of areas targeted through Residents First, and they're starting to show their trends, and they're starting to make progress, and they were very proud, and deservedly so. And so again, that strategy of building capacity so that those long-term care homes can work together, and again, the strength of that process being system-wide, is what's really starting to move the dots for us. And then another good example in our LHIN, and it was a recommendation that came out of last year's symposium, was the introduction of governance education sessions in our LHIN. So some of you will be aware that we offered governance education sessions, really targeting some of our smaller community providers that might not have the opportunity to get that kind of educational support. And there was a focus on that within those sessions around quality improvement and the opportunity for organizations in that area. So again, we've been trying to put into place through our strategies and through the different things that we're doing, opportunities to really build capacity to support quality improvement. Applying evidence in decision-making, there's a number of examples of initiatives that are very much evidence-based driven, and I won't talk about those to any great extent. But the one piece that I will highlight from this visual is the report on performance and the governance scorecard that the LHIN is now producing. So we now have available on our website the report on performance, which comes out on a monthly basis, and we're tracking our indicators and making that data accessible to all through our website. We can look at our trends over time, we can drill down and look at individual organizational performance as well, and so it's a tool for providers to use and for the LHIN to use to really understand where we're at in terms of our journey and the outcomes that we're trying to achieve. And then we talked about health information systems, and I could spend a lot of time talking about the Ehealth Agenda of the LHIN. There's a number of key initiatives that are really looking at how we can use enabling technology to support the work we're doing. Examples like SPIRE, the CSWO initiative, and others that are out there. We're working on the development of an integrated decision support system. And again, that's borrowing from work that's happened in other LHINs where great progress has been made on bringing data together, linking data that really reflects the client journey or the patient journey across the system, so we can target those improvement opportunities. So there's work in those areas as well within our LHIN, and shortly we'll hear from Dr. Sands as well around technology and how it really can impact the care process. And then around engaging. So today's a great example of that. We want to celebrate and bring together the folks from across our LHIN through initiatives like the Residents First Collaborative. Quest for Quality is the website we want to draw people to where they can access information and really create some collaborative forums as well. So again, number of strategies to bring people together so that we can continue to work in a positive way. And then how do we keep motivating? I think today was tremendous with the actual delivery of the quality awards. So it was wonderful to celebrate the initiatives that are happening in our LHIN, and it's a process that we can keep moving forward within the Southwest to continue to motivate, engage, and acknowledge the great work that's happening. And then looking at strategies like alignment through financial incentives. So the ED Pay for Results, another great example of an initiative where there's financial incentives for the outcomes that are trying to be achieved. So we need to look at multiple ways to motivate, and we're starting to see a number of examples of that in the Southwest and across the province. So I just wanted to talk briefly around some of the initiatives that have already been mentioned, and I don't need to say much more about BSO. Again, it's one of those initiatives that really is looking at change at scale, not only in our LHIN, but across the Southwest, or across the province rather. And then access to care I wanted to touch on briefly. For those of you that were here last year, you'll remember Camille Orridge coming and talking about Home First and access to care and the progress that they were making. And when I reflect again in really what's been a relatively short time span in the last year, we've made huge strides in our access to care initiative within the Southwest. So we have hospitals now that are starting to implement the Home First philosophy, starting with London Health Science Centre and St. Thomas Elgin General Hospital. We're watching that data, and our trend lines are showing progress on our ALC indicator, and that is being sustained over time. And we're also doing work looking at our assisted living, supportive housing, and adult day program areas, and how we ensure that we have equitable service access across our LHIN, that the right people are accessing those services, and the people that are most in need of those services have access. And we're also looking at that with respect to complex continuing care and rehab services. And the recommendations coming out of this work speak to significant change within our LHIN. And so I'll just maybe flag that you should receive a save the date tomorrow for a webcast on June 12th. We're not able to go into a lot of detail today on the recommendations, but we'll be sharing those on that webcast, and lots more discussion and dialogue around the impact of those recommended changes across the LHIN. And then partnering for quality I want to touch on, because you heard last year about the successes of Partnerships for Health, the 73 primary care teams that have been engaged through that process with other partners to improve diabetes care. We saw tremendous outcomes, and we've been challenged this year to really keep that momentum going. We've been able to sustain the relationships between the primary care practices and the CCAC and other partners, and we are very actively looking at how we spread now to a vascular strategy and reach out to more primary care practices and continue this work. So just quickly, some next steps. We have asked our Health System Leadership Council members to actually respond to a survey, and they haven't received it yet. But what we're trying to do is actually now start using our Quality Enabling Improvement Framework. And we've asked those council members to take the framework and do a bit of a, I'll use the word audit, but a bit of a reflective look inside their organizations at where they sit with respect to the different components of the enabling framework. And our hope is to do that type of capacity assessment more broadly across the LHIN. Again, we're going to continue to use the framework to drive our strategies within the Southwest, both overall in terms of the kinds of things we're putting in place, but also, again, reflecting on each of our individual initiatives, wanting to ensure that we have all the key ingredients for success as we do our work. And so we believe that making sure we're covering off all the components of the framework will help us to ensure that we are achieving our outcomes on behalf of patients, clients, and residents here in the Southwest. Our intent is to share the framework widely. So there's snapshots of the framework sitting at your table today, but we'll be distributing the framework out to health service provider organizations. There's no expectation that you must use it. It's a tool that's there for you to access. We encourage you to use it if it's helpful to you as an organization. And again, we'll be using it in the work we do here in the Southwest. And our commitment is to continue to integrate quality improvement into all the work that we do here in the Southwest LHIN. And so the challenge for all of us, I think, as we leave here today, what will each of us do from this day forward to continue to support quality improvement within our healthcare system? So we'll pause there, and if anybody has any questions for Gord and I, we'd be happy to try to address those. And since no one's racing up to the mic, then it's your job to have discussion at your tables. And so you'll find on your tables some additional questions, and they actually do relate back to the components of the framework. We're going to ask you to spend some time at your tables talking about these. There's no requirement to report back, but if you could document the ideas that you're coming up with on the yellow worksheet, we will collect them at the end of the session, and we'll summarize those and make the information available back to you, and it will also go to our quality advisory group for their continued work. So thank you, and you now have about 20 minutes at your tables for your discussion.